Hello, my friends. I'm Dr. Nora Hayes, a urologist and men's health specialist with 7 years of experience helping men over 50 reclaim confidence, energy, and intimacy. Today, we're going to tackle one of the most honest and yes, slightly blush-worthy questions I hear in my clinic. This is the kind of thing many men carry silently, often too embarrassed to ask, but it's time to bring it into the light. So, let me ask you straight. Have you ever wondered if it's safe to swallow vaginal fluids during oral intimacy? What about the taste, the smell, and whether it's healthy? I know some of you may be squirming just hearing that, and that's okay. You're not alone. These are questions whispered late at night, searched online, or asked hesitantly in a doctor's office with lowered eyes. By the end of this video, you'll feel informed, reassured, and confident about intimacy. No shame, no guessing, just clarity. Before we dive in, hit that like button, comment below. Where are you watching from? And subscribe to my channel for more guidance designed for men over 50 who want confidence, health, and connection. Here's a truth that surprises most men. Intimacy does not retire. Passion doesn't have an expiration date. Love, when nurtured, only deepens over time. Many men assume oral intimacy is risky, dirty, or something to avoid. But the scientific truth is far more reassuring. With healthy partners, vaginal fluids are completely natural, safe, and even a sign of the body protecting itself and making intimacy comfortable. So, the first myth we're busting today, vaginal fluids are dirty, false. They're actually a biological marvel designed to lubricate, protect, and enhance pleasure. I'm Dr. Nora Hayes. Over my 7 years in urology and men's health, I've worked with men in their 50s, 60s, and even 70s who thought intimacy was over for them, only to discover that small, intentional changes completely transformed their relationships. I've helped men go from embarrassment and avoidance to confidence, closeness, and joy in their sexual lives. Today, I'm going to guide you step by step, covering the biology, the emotional impact, and practical daily applications so that intimacy becomes safe, satisfying, and deeply connecting. Mistake number 1, thinking vaginal fluids are dirty. Many men feel embarrassed thinking these fluids are unhygienic. Biologically, vaginal fluids are mostly water with amino acids, enzymes, trace minerals, glucose, and lactic acid. These ingredients keep the vagina healthy, balanced, and protected. Think of it as nature's personal lubrication system designed to make intimacy comfortable. Emotionally, seeing them as dirty creates unnecessary shame, which can dampen connection, intimacy, and trust. Practically, for healthy couples, swallowing fluids is generally safe, often less risky than kissing deeply, sharing drinks, or even eating unwashed fruit. One patient, a man in his mid-60s, told me he avoided intimacy because he thought she might be dirty. After we talked about how fluids are natural and protective, he tried slow, intentional oral intimacy with his partner, and he described it as a whole new level of connection, the kind I'd forgotten even existed. Mistake number 2, ignoring safety and STI. Even though fluids are natural, they can carry infections if a partner is affected. Biologically, vaginal fluids can carry STIs such as chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, and HIV. Risk increases if the receiving partner has mouth sores, bleeding gums, or ulcers. Emotionally, avoiding this conversation creates anxiety, distance, and secrecy, all of which harm intimacy. Practically, routine STI testing, open dialogue, and barrier methods reduce risk dramatically. Couples often find that getting tested together actually deepens trust instead of diminishing romance. A man in his 60s panicked after a new partner because he had bleeding gums. We did a joint consultation and testing. Both tested negative. He told me, "I've never felt closer to her. Doing this together made me feel responsible and connected, not scared." Mistake number 3, rushing intimacy. Many men focus on mechanics or performance rather than presence. Biologically, nerves respond best to slow, deliberate touch. Rushing can trigger the stress response, reducing pleasure and connection. Emotionally, women feel cherished and safe when their partner is patient and attentive. Practically, pause, observe, and linger. Slow attention creates arousal, trust, and deeper emotional connection. I had a patient mid-50 who previously rushed to finish intimacy. Once he slowed down, paying attention to subtle cues, a soft touch on her back, a gentle whisper. His partner described the experience as the most intimate I've ever felt in 20 years. Mistake number 4, fearing taste and smell variations. Men often worry if fluids taste or smell different. Biologically, variation is normal. Hydration, diet, hormones, stress, and medications all influence taste and scent. Pineapple, berries, or citrus often lighten taste. Garlic, coffee, and alcohol can intensify it. Hormonal shifts during ovulation, menstruation, and menopause also play a role. Emotionally, accepting these variations communicates respect, care, and non-judgment, reducing shame. Practically, sudden, strong, unpleasant changes may indicate bacterial vaginosis or yeast infection. Both treatable, approach with teamwork, not criticism, perhaps a refreshing shower or a little conversation. One couple noticed subtle changes in taste over time. Instead of judging, they laughed, drank water, and shared fruit together. She told him later, "I've never felt safer and more accepted." Mistake number 5, ignoring emotional connection. Intimacy isn't just physical. It's about trust, acceptance, and presence. Biologically, when a woman feels safe, arousal deepens, orgasms intensify, and responsiveness increases. Emotionally, embracing her fully communicates, "I accept all of you." Judgment shuts down desire, acceptance amplifies it. Practically, gentle kisses, slow touches, and reassuring words create secure emotional space. A patient shared, "I focused on connecting with her emotionally first, rather than just getting physical. The intimacy afterward felt effortless. She opened up in ways I'd never experienced before." Here's your step-by-step roadmap. Start the conversation. Discuss STI testing openly as a partnership, not mistrust. Use barriers when needed. Dental dams or condoms show care, especially in new relationships. Make routine testing a habit. Twice yearly for long-term couples is ideal. Embrace presence, focus on attention, patience, and observation over speed. Celebrate variation, accept taste, smell, and flow differences as natural. Create emotional safety. Gentle touch, kind words, and mindfulness enhance both physical and emotional connection. I guided a couple to implement all 6 steps. Within months, their intimacy was richer, more playful, and more connected than it had been in a decade. "They told me we're not just lovers, we're partners in every sense. Gentlemen, let me reassure you. Age is not the end of passion, desire, or connection. When you communicate openly, accept natural variations, and act with presence and care, intimacy becomes more meaningful and memorable than ever." Even small gestures, a slow kiss, gentle touch, or honest conversation can transform a relationship, creating trust, comfort, and deeper pleasure. One man in his late 60s told me, "I thought intimacy was behind me. Now, with just a few adjustments and more presence, I feel more connected to my wife than I did when we first married." Tonight, try this. Approach intimacy with awareness, patience, and compassion. Talk openly. Pay attention to her responses. And remember, your presence is more powerful than any technique. If you found this helpful, like this video. Comment below what surprised you the most, and subscribe for more guidance designed specifically for men over 50. Passion doesn't retire, confidence doesn't fade, and intimacy approached with knowledge, patience, and respect deepens with age. I'm Dr. Nora Hayes reminding you, small changes today can bring comfort, freedom, and confidence tomorrow. Take care of your health, heart, and relationships because you deserve pleasure and connection at any age.